What you need to know about strep throat.
Strep throat is caused by the bacterium Streptococcus pyogenes, also known as Group A Streptococcus. This disease is typically caused when the bacteria enters through the mouth or through the nose. Inflammation and irritation is the effect of damaged tissue. This can be due to the release of toxins by the bacteria such as streptolysin. When infected, the body responds with an immune system attack. This is what leads to the typical symptoms of strep throat.
How is this disease transmitted?
Strep throat is very contagious and can be caused by a variety of things such as the spread of respiratory droplets through actions like
Talking, coughing, kissing, and sneezing. Symptoms to be aware of.
strep throat can cause a multitude of symptoms, with the most common being
severe sore throat, pain while swallowing, swollen tonsils and lymph nodes in throat, nausea, and fever.
How can it be prevented?
While there are no definite ways to prevent strep throat, there are some precautions that can be taken to lower the risk of infection.
Avoiding close contact with those infected until treatment has been received. Limit spread of respiratory droplets by covering mouth when sneezing and while coughing. Regular hand washing and practice of good hygiene. Also, disinfecting commonly contaminated surfaces, such as doorknobs, tables, and other shared objects. Who is most at risk for developing strep throat?
It's important to know that while everyone can get strep throat, some groups may be more susceptible. Children ages 5 to 15 are generally the ones most affected. This is due to their underdeveloped immune system. Those with underlying health conditions are also more at risk. This is because of a weakened immune system, making it more difficult to fight off infections. Lastly, those constantly in close contact environments are also at a higher risk. This is due to the increased ease of transmission in places such as schools, households, etc.
How can strep throat be treated if you have it?
Strep throat will not typically go away on its own. Antibiotics such as amoxicillin or penicillin are commonly used to treat this and eliminate bacteria. This helps with the shortening and elimination of symptoms as well as reduction of spread to others. Rest, hydration, and pain-relieving medications can help calm symptoms but will not get rid of the bacteria causing the infection.
How prevalent is this in our area?
Prevalence of this illness is not particularly increased in San Francisco. While it is most common in winter and spring, outbreaks throughout regions are generally the same. Better hygiene and sanitation practices throughout different areas of the city can help limit the spread of strep throat and decrease the prevalence overall.